Hello, I am Dr. Veerendra Koujalagi. I am medical gastroenterologist practicing in Sahakar Nagar, Bengaluru at my clinic Eka Gastro and Liver Care. IBD is also termed as inflammatory bowel disease. So, inflammatory bowel disease is a condition where your own immunity is attacking your bowels, resulting in lot of morbidity and mortality. So, what is this inflammatory pathway which causes damage to your bowel? So, because of our change in the lifestyle and intake of lot of processed food, what happens is the gut immunity mistakes lot of your normal bowel proteins as foreign and it attacks, causing damage to the bowel. Whereas there is a similar sounding condition called as IBS, that is Irritable Bowel Syndrome. This happens because of impaired brain gut axis, where there is changes in the bowel are misread by the brain as something really problematic and it is taken up as serious issue. So, this tends to happen in form of either diarrhea or constipation, where without actual problem there can be increased frequency of stools, there can be abdominal pain, or there can be constipation associated with abdominal pain. IBS is quite benign. IBS does not cause any change in longevity of your life, but it is definitely nuisance, impairs the quality of life. But in case of IBD, it is a real damage that is happening to your bowel. It is immune mediated by your own body and it can be life threatening at times. So, how do we diagnose IBD? IBD usually presents as abdominal pain or bleeding stools associated with vomiting, or there can be increased stool frequency in terms of diarrhea also. So, it is sometimes difficult to differentiate IBS and IBD. So, how do we differentiate? So, IBD usually is associated with patient being very sick and is also can be determined by blood tests and stool tests. We can also do colonoscopy, which helps us to look into the colon and small intestine and determine if there is any ulcers or other changes which are seen in IBD. But IBD is manageable. Nowadays, there are a lot of medications that are available which can be managed and treated very well. And IBD can be brought into remission and a person can live a normal life with normal activity living with IBD. But it is important to be aware of this condition and report to your doctor whenever these symptoms are there, and doctor would check you up for presence of IBD. IBD doesn't always mean long-term steroid use or surgery. Many times there are medications which are subtle which can be used, and with the arrival of new molecules almost every year now, so management of IBD has become more easy. But how do we prevent this from happening is again by preventing usage of processed food and food additives in our diet.